Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 6 intro. If you are new to TST, that is tissue salt therapy, viewing parts 1 to 5 is a must. Because in these parts, very important technical things have been elaborated. How to select a particular potency, what will be the repetition, what will be the amount of dose. These are very technical. Unless you know this, you cannot learn the therapy. So this is a must. Please remember this. How to initiate treatment of a new patient? Treatment is given to patient according to their natures of diseases. According to nature, diseases are broadly classified into two: acute diseases, chronic diseases. In some literature, it has been classified in three: acute, subacute, and chronic. Subacute diseases are diseases which lies between acute diseases and chronic diseases. In case of acute disease, generally on the top of the prescription, date of visit, name, age, sex of the patients are jotted down. Thereafter, signs and symptoms of the case in brief are noted. Then names of the medicine, its potency, dose, and other advices to the patient follow. At last come the signature of the physician. Please note this specimen on the right hand side. This please note it attentively. This is a very important thing, how to start a new acute case. What is a case history book of a patient? When is it prepared? How and who maintains it? For treatment of a patient suffering from chronic ailments, a notebook is prepared on the first date of visit. The book contains complete details of the patient's past history, her family history, personal details, present ailments, history of medicine already taken or being taken currently, and doctor's current advice. This is called case history book. Doctor prepares it and maintains it date-wise. This is a very important document to a doctor since it contains chronological history of the patient's status. This is doctor's personal belonging and a patient may get a copy of it on request. Why is a case history book required for a chronic case? One must realize treatment of an acute disease and treatment of a chronic disease are two complete different approaches. It is very easy to collect symptoms of an acute disease, for their number is few, and nowadays various combination medicines are available with names of the diseases. So treating an acute disease is comparatively an easy, simple and less tedious task. But treating a chronic disease is always challenging. In such a situation, a patient usually suffers from various diseases, had taken so many treatments from a number of doctors. Many aspects of his life or her life have to be taken into consideration. And finally, the treatment procedure generally takes a long time. Doctor must take down the status of a patient, his advices on every visit. Patient's own reporting and doctor's advice. Everything date-wise must be recorded in it. So every good doctor needs to keep an account of his task chronologically, starting from the date of first visit till the last date of the dates of visit of the patient. Herein lies the need of a case history book of each chronic patient. How a case history book is actually prepared. First, name, guardian names if patient is minor, address, email, phone number, date of birth, sex, religion, marital status. In case of a married female woman, number of issues, date of last delivery, and date of first visits are noted. Next, the following information are taken down. Number one, what are the present and past addictions with durations. That is, patient's past addiction, present addictions with duration must be noted. Number two, what medicines were and are being taken with duration for last 2 years. Number three, current signs symptoms chronologically with location, sensation, causation and modality. Locations means where the symptom is felt or noted. Sensation means how does it feels by the patient. Causation means how it's caused. What is the cause? How it happens? That thing. Modalities mean how it, when it does it, when it is aggravates, under what circumstances it aggravates, under what circumstances it ameliorates. Number 4, history of past illnesses from birth chronologically, especially skin disease, arthritis, rheumatism, piles, hemorrhoids, fissure, fistula, asthma, TB, pleurisy, cancer, diabetes, gonorrhea, clap, syphilis, AIDS, HIV, history of dog bite, snake bite, or any other mentionable disease with duration of suffering and how it is cured or relieved. These all things are to be noted. Number 5. Note whether any family member in the family of maternal and paternal sides of the patient who had suffered or currently suffer from any of the above mentioned diseases. Number 6. Finally, on every date of every visit of the patient, on every date of the visit of the patient, his or her version of reporting, copy of any pathological report produced, doctor's advice are noted chronologically. Six, patient's subjective symptoms. Number A, note whether patient is chilly or hot, whether bath is taken in ordinary tap or tubal water round the year. That is whether he takes the bath in ordinary water or hot water. This is important. Whether sun heat is tolerable, whether cold is caught easily. What about appetite, thirst, sleep, problem in pee or poo? Number B, which foods and drinks does the patient like most, least, or intolerable? These are all subjective symptoms. That is, these symptoms represent the patient, total patient. His total, either it is mental general or it is physical general symptoms. General means it covers the whole being. Is there any sleeping problem? Note down in the language of the patient. Mind most of the symptoms should be noted as the patient speaks in that particular form. D, if patient is a male, take down his own language, his sexual problem, if any. If the patient is a menstruating lady, note in her own language all problems before onset of menstruation, during menstruation, after menstruation, along with uterine problem and nature of leucorrheal discharge, if any. Take down also her sexual problems, if any, in her language. Finally, note down any disorder about patient's mental state. Finally, mnemonic to remember the names and corresponding solid numbers. This is the second time I am describing it. In the last part of the fifth video also I have done the same thing because it is important, so I am again repeating it here. You must have noted that these 12 salts, the name of these salts and their salt number are fixed. That is, if you tell salt number 8, then it will be magnesia phosphorica. Nothing else. Again, if you say kalium mureticum, then it is salt number 5. If you say silicea, it is number 12, salt number 12. If you say calcarea fluorica, it is salt number 1. That is, salt number and the name of the salt are attached and fixed. Now, how you can remember this at the tip of your finger? At the help of tip of your finger, how can you remember this? That is a type of mnemonic I have devised myself. Please just try to understand my logic, but it is not fixed. You can devise your own style also. First, what I have done, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I have written this thing and I have just kept 4, 8 and 12 between two slashes. That is, there are some exceptions here. Note this here, 1, 2, 3, C, 5, 6, 7, K, K, K. 9, 8, 10, 11, ne, ne, ne. That is, this, if you just take out 4, 8 and 12, then all the 9s are in rhythm of 3, same salt. 1, 2, 3, K, K, K. 5, 6, 7, K, K, K. 9, 10, 11, ne, ne, ne. And in case of 4th and 8th, it is a new salt, Fe, Me. And in case of 12, it is also new, Silesia, C. So, this portion, every salt has got two portions, cationic portion and anionic portion. The cationic portion, K, 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 Fe. Mind it, I am going by the finger. 1, 2, 3, 4, K, 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 Fe. 5, 6, 7, 8, K, 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 Ma, Me. 9, 10, 11, 12, Ne, 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 Si. So, some rhythm is there, you can follow, I think. The number 4 and number 8 salt are different type, and 12 also. All other 1, 2, 3 same salt, 5, 6, 7 same salt, anionic or catonic portion, 9, 10, 11 same catonic portion. Now come to anionic. The first one has got fluoricum. Fluoricum is exceptional. It occurs only one. In other cases, either it is phosphorus or sulfur or muriaticum. You see this thing, calcarea phos, calcarea sulf, and 4th and 8th are always phos, ferrum phos, meg phos, and 12 has got no anionic portions, only silesia. So if you separate this thing, 4th, 8th and 12, where only phosphorus and no anionic portion is there. In all other cases, there are some rhythms. What rhythm? You see this 5, 6, 7, Mi, Fa, Sha. Muriaticum, phosphoricum, sulfuricum. 9, 10, 11, muriaticum, phosphoricum, sulfuricum. And 4th and 8th are always phosphorus, I have already told, and first one is fluoricum. So, how will you remember according to our fingertip? K, 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 Fe. K, 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 Me. Ne, 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 Si. Then how will you remember this anionic portion? The first one is always fluoricum. And since the in the rhythm of 3, it is always Mi, Fa, Sha, and Mi is occupied in the first place by fluoricum. So rather the next two will be Fa, Sha. 5 and 8 will always phos. So these are separated. Now 4th and 8th are always phos, so they are separated. 5, 6, 7, Mi, Fa, Sha. Muriaticum, phosphoricum, sulfuricum. 8, 9, 10, Mi, Fa, Sha. Muriaticum, phosphoricum, sulfuricum. I think you follow what I want to convey. There's 4th and 8th are always phosphorus. The first one is exceptional fluoricum. 12 is exceptional only silica or silesia. In all other cases, the cationic portion is very nice, similar. K, 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 number 4, Fe. K, 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 Fe. K, 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 Ma. Ne, 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 Si. Then anionic portion, the first one is fluoricum, so leave it. For Sha. 4th and 8th is always phosphorus, so leave this. Now 5, 6, 7, Mi, Fa, Sha. 9, 10, 11, Mi, Fa, Sha. Now this is the